Today, I'm going to talk with you about how an aging life care professional can be as helpful and supportive to your family and your aging older loved one with memory issues as a Big Ten college football head coach like Paul Christ for the Wisconsin Badgers. So how I'm going to do that is I'm going to tell you about a few of the most common questions that I get asked in my work, and to help you better understand kind of what it is I do and how I help people. So one of the common questions is, do we need more help? And what sort of help is out there? And can we afford it? So families come to me often with that question. Do we need more help? I kind of think we do. And what help is out there? And can we afford it? And so for me, that's kind of like asking who needs to be on the team. Who are the different parts and people and support and services out there that need to be on the team? And I help answer that. So maybe, this is the son or daughter. Maybe this is the neighbor. And maybe this is the senior support agency that they need to wear around them as their gear in order to be fully supported in caring for their older adult loved one. Or maybe that vest is the caregiver. So who needs to be on the team is one common question that I answer. Next, I often get asked, when is it time for my loved one to move? When do they need to move to an assisted living, to a memory care community, to a nursing facility? What are these different levels of care? What do they mean? And when is it appropriate? When is it time? Based on their money and what makes sense and their care needs. When's a good time for them to move? Or are we past that point? So in terms of that, I kind of think of it as like, when do we need a new stadium? Our stadium is kind of old and the seats are rickety and people are getting hurt in the stands because of that. And I think it's time for a new stadium. So when is it time to move to a different level of care? I like to try and keep people in the same stadium for as long as possible. So most people want to live independently at home, and that's how I best want to support them. But if it seems like the most appropriate and the best option at that time is to move to a senior living community, I will tell someone that, and I will tell them at what point. But kind of when is it time to get a new stadium? The third question that I get asked most often is how do we get everyone on the same page so that things don't fall through the cracks? Because we're worried things are falling through the cracks for our mom or our grandma or my spouse. I'm not sure we're doing everything we need to be doing for them. So what I do is I determine how can we all communicate and work together as a team so that nothing falls through the cracks, so that no balls get dropped. Because so easily things can get dropped, even when you have the most supportive family, the most supportive environment. Sometimes balls can be dropped. And so I want to make sure that we're all communicating and coordinating and working as a team on the same team so that doesn't happen. And then another question that I commonly get is about medication. Is my loved one taking the right medications? Are they actually taking their medications, their inhalers at the right time of day? Are they actually taking their pills? I don't know. I'm not sure. Do they need help with this or not? I can't get them to accept help with it. So how do I do that? So it's a common question I get is, are we on too many inhalers? Do they need an inhaler for their asthma on the team? Are we on the right inhalers? Are they seeing the right doctors? And so maybe they need a pulmonologist because they have lung diseases and they've never seen one. What is a pulmonologist? Why do we need to see one? When do we not need to see one? That kind of thing. I help answer those questions for families. So hopefully that gave you a little preview as to why working with a care manager is kind of like working with a Big Ten head coach in terms of giving you guidance and direction, in terms of knowing who needs to be on your loved one's support team. When is it time for us to get a new stadium? When is it time for them to move to a higher level of care, like an assisted living or memory care or nursing facility? How can we all communicate and work together as a team so that nothing falls through the cracks? And are we on the right meds? Is my loved one on the right meds? Are they actually taking them right? How do I get them to do that? So those are 4 questions that I get often from families and spouses of older adults who are dealing with memory issues. And so hopefully that's helpful to get a little glimpse into what I do.